I'm now joined by Professor Ismail from Wits, who will expand more about the missing TB patient. Who is this? What does it mean? And what are the efforts that could be put in place to, in particular, give support to these individuals? Thank you so much, Prof,
Pleasure.
for joining us. Just educate the nation. When we talk about the missing TB patient, who is this?
So the missing TB patients are individuals that have TB but don't realize it yet, or may realize that they have a health problem but are scared to come forward to seek care. So it's an early stage of disease.
And why are they scared? What makes them so reluctant? Are they aware that they might have TB?
So I think the first group of people are individuals that have very mild symptoms. They might have a bit of a cough or fever. And what that means is they might not realize that they have TB necessarily. They might think it's a common cold, etc. But TB is quite common in the country, and often the longer you take to come for care, the worse the prognosis is. So I think that's the one group of people where they might have mild symptoms, and the thing is treatment and diagnosis are all free in the public sector. So that's the one group. The second is individuals who know they are ill, they are aware of their symptoms, and are afraid to come forward. Right? And I think this has twofold risks. The one is to the individual himself or herself, where they might, the disease will progress and become more difficult to treat. So if you often treat it early, the success, it's a curable disease, and people do fantastic on treatment. So I think that's the one factor that we need to appreciate, where people may have this disease and are scared to come forward. The second is often there's a bit of stigma. But I think we need to appreciate one important thing. So often we always think of HIV and TB as a common association. But if you look at the latest prevalence survey, there's more people with TB that don't have HIV than do have HIV. So it's not that you have HIV if you have TB, right? And I think it's not a common association anymore.
When we look at the high numbers of perhaps people in the country who still die of TB-related illnesses, how does that group contribute to these high figures?
Yeah, so I think, when we're talking of a person that died of TB, it meant that they were presented very late. So they might have had early symptoms and have been progressing over a period of time. So the mortality is related to delay in health seeking often. But the important thing for the community is that they've been out in the community for months coughing, intermittently or continuously. And they've been transmitting to their near and loved ones as well. So it's really also a community responsibility to make sure that we can, if you know of someone that's coughing and it's not going away, you should be helping and taking them for care, because it actually protects you, protects your children, protects the people around you. So I think that's the one potential risk in terms of that delay. So the mortality is really driven largely by late diagnosis. And we're really trying to get people early into care. And the tests that we have are fantastic, they're cheap. They're technically free for public sector patients.
Between men and women, who falls more under that particular category of the missing TB patient?
Yeah, so unfortunately it's men that carry the higher burden, but they're also the ones that are the missing groups mainly. So we often find that men don't come for care, right? So it's a behavioral issue, and there's no stigma to it. In reality, is that it doesn't make you a weaker person if you have TB. Mandela, right, had TB before. He was a man, and he was cured. If he had to die, what the world would have been without him, right? So there's no harm and fear in a man coming for care. And the medication can be a bit strong, and for it's good, you need strong men to take the medication, right? So men are a particular concern in terms of health seeking. And it's not just TB, it's HIV, it's many health diseases. And we really need to change that mindset. And the thing is, services are available in this country everywhere.
And as we are about to mark World TB Day, as a country, collectively so, as we've heard the calls here today, that it's time that everybody come on board, hold hands, whether it's the media, the public, experts, government officials, to do the best that they can to either create awareness, educational drives, and really also debunk the stigma and the myths, the distorted information around this. But what more can we do to make sure that we conscientize society and we sort of destroy the fears that exist out there?
Yes, so the thing is to break barriers in terms of stigma are quite difficult. But I think, we've really got the messaging bad in a sense that TB is curable. If you look at in the country, at least a decade ago, we had 400,000 people with TB, right? It's not an uncommon thing. There's nothing to be scared about if you have TB, right? It's something that, it does occur commonly. It occurs every year. I guarantee you people watching me today I know of people that have had TB. They're afraid to tell others about it, but there's nothing to be scared about telling others about it because it's so common. And the vast majority are cured. So I don't understand the stigma that people have. It's just an ingrained fear of the unknown, but technically it's a disease that has been around for a long time, easy to diagnose, easy to treat. So I think it's just a mindset that needs to shift in our communities. And it's very different. I mean, we cure lots of patients.